If you had ACL surgery using a quadriceps tendon graft and you still have nagging graft side pain right above your kneecap months later, this video is for you. That aching, sharp, or even burning pain right where one of your incisions is, more often than not, is quadriceps tendonitis. And you were probably told one of three things. Either that's normal, just push through it, or it just needs more time. But here's the truth. Every graft has unique rehab implications. With quad tendon grafts, quad weakness, graft side pain, and tendinopathy are more common than with other graft types. But just because it's common doesn't mean it's just part of the process. If you keep blindly pushing through pain without a plan that actually respects tendon loading principles, you're going to stay frustrated, sometimes for months. In this video, I'm going to break down why quad tendon graft side pain happens, what actually stresses the quad tendon, and a step-by-step game plan to calm things down and then rebuild a strong, resilient quad tendon. And if you want a full breakdown of all ACL graft types and their rehab implications, I'll link that video in the top corner and also in the video description below. Let's get specific. That nagging, aching, or even sharp pain just above your kneecap, right near the incision, that's graft side pain, most commonly presenting as quadriceps tendonitis, or more correctly, tendinopathy. And if you want to fix it, you need to understand why it's happening, not just throw more exercises at it. During ACL surgery, surgeons will typically harvest the superficial or the outermost layer of the quadriceps tendon to make a graft to reconstruct your ACL. This is important to understand because this will change how that tissue tolerates load during rehab. So now the question becomes, what types of movement place the most stress on the quad tendon? The rectus femoris is one of your four quadriceps muscles, but it's unique. Unlike the other three, it crosses both the knee and the hip joint. So in addition to extending or straightening the knee, it also flexes the hip. Because of that, the rectus femoris, and therefore the superficial quad tendon, is stressed most when the knee is bent and the hip is extended. Split squats and lunges. These exercises can be deceiving because people with quad tendonitis often feel pain when their surgical leg is the rear or the trail leg because your quad is working as it enters knee flexion and hip extension when you lower down. The deeper you go into knee flexion while the hip moves towards extension, the more tensile and compressive forces you place on the quad tendon. Now, quick clarification. Force itself, it's not a bad thing. Too much force, far beyond the tendon's current capacity to handle it, can become problematic and cause pain or injury. Too little force that never truly challenges the tendon will never make it actually get stronger. We need a happy medium. The issue I see all the time is a massive mismatch between tendon capacity and exercise loading. And here's where people get tripped up. Even in exercises where the hip is moving into flexion and shortening the rectus femoris at its hip attachment, like squats, leg presses, and lunges in the front leg, the deeper you go, the more compressive load is placed on the quad tendon. In addition, deeper knee ranges shift some more of that stress away from the patellar tendon and towards the quad tendon. So when someone with a quad tendon graft is doing too much deep knee flexion and they're performing a high volume exercise program and they're doing multiple quad dominant exercises, or they never have been truly challenged in their rehab, it's no surprise that graft side pain develops and sticks around. Quick disclaimer, this is general education, not individual medical advice. There's no way to know exactly which variables you need adjusted without a proper assessment. If you've been dealing with ongoing pain, weakness, or frustration, and you want a detailed evaluation from an ACL specialist, head to the link in the description to book a free call with me. I'll review your situation, identify the bottleneck in your recovery, and build a clear plan forwards. Now, let's talk strategy. Here's my 3-step process. Step 1, put the fire out. An irritated tendon needs relative rest. Not complete shutdown, not doing nothing. Relative is the key word. We want to stay strong while strategically reducing stress on the irritated quad tendon. So the first adjustment is the range of motion. Limit how deep you're going on quad dominant exercises like squats, leg presses, knee extensions, and lunges. By avoiding the deepest knee flexion ranges temporarily, you can continue to strengthen your quad muscle while shifting some of that stress away from the graft site. If symptoms don't improve, the next lever to pull is reducing quad dominant exercise volume. This is a huge culprit. All too often, my clients come to me with this exact issue, and their current exercise routine has way too many quad-based exercises and way too many overall sets. Even in healthy individuals, the volume that I see is often just overkill. Now, layer a major surgery recovery on top of that, and you can hopefully see why these issues tend to last for so long. Here's an example of a client's program that I adjusted. I literally cut her quad dominant volume in half, and her symptoms improved quickly. Now, this doesn't mean that you can't build back up. It means that sometimes you need to take 2 steps back to be able to take 10 steps forward. Now, how do you know if you're actually on the right track with this? Irritated tendons often behave in a predictable pattern. They hurt early in a session, like when you're starting to exercise or when you're warming up, right? Then they tend to have this warm-up effect where the pain decreases or sometimes even goes away completely, and then the pain tends to return later in the day or within a 24-hour period of that session. So feeling better during a workout can be a good sign, but you need to monitor how you feel over the next day or two. An increase in pain within a 24-hour window is your knee's way of saying what you did may have been too much. Step 2, strategically build back up. Once pain levels drop and stabilize, it's time to rebuild capacity. So phase 1 here. Start by gradually reintroducing deeper knee flexion ranges. Isometrics tend to work really well here and often help with pain with exercises like knee extension isometrics in more flexion, wall sits, and prone knee extensions. 3 sets of 45 to 60-second holds can be a good starting point, but it must be progressed over time. If deeper knee ranges are tolerated, phase 2 involves gradually increasing quad dominant exercise volume. Sometimes deeper ranges need more time to adapt, however. So volume increases outside of those ranges may be better initially. So what does this mean? For example, let's say you've been doing 2 sets of half squats and you just increase your range of motion to full depth squats. Stick with the 2 sets for a few workouts and just see how your knee responds. If all goes well, you can opt for increasing the number of sets for a quad exercise at more shallow ranges, such as knee extensions. And then finally, increasing the number of sets for the full range squats if everything goes well. This is where working with an ACL specialist saves you months of trial and error and the risk of having a setback. Now, exercise intensity is also incredibly important. Tendons positively adapt when they experience sufficient strain, which requires relatively heavy loads. Building up enough strength in the quad muscle and the quad tendon is absolutely essential, and this must be properly measured with a strength test. If you want to know how quad strength should actually be tested after ACL surgery, check out the video linked above and also in the description below. Now, phase 3, once adequate strength is established, we add speed. Plyometrics are the bridge between strength and athletic performance. So tendons don't just respond to how much load, they also respond to the rate of loading. If you want a quad tendon that can handle running, hiking, sports, and an active lifestyle, plyometrics are essential. If you want me to make a full video on plyometrics after ACL surgery, comment the word jump below. So quad tendon graft pain is common, but it's not something to ignore. It's driven by specific loading patterns, and it only improves when stress is managed and rebuilt strategically. So if you're tired of spinning your wheels, if you feel like you're doing all the right things, but you still don't trust your knee, and you want a specialized ACL-focused team that you can trust, head to the description and book a free call with me. We'll identify the exact bottleneck in your recovery and create you a clear game plan to get back to the activities that you loved. Strong, confident, and pain-free. And if this video helped you, please like, subscribe, and share it with someone who you think would find this valuable. I'll see you on the next video.